Hello and welcome to House Call. I'm Dr. Ruben Brock. With today's consult, I'd like to talk to you about when to seek help. One of the most common questions I get from parents is how to know when it's time to take their child in to seek help for an issue they may be struggling with mentally or emotionally. And so I'd like to try to answer that question for you and give you some ideas about when it would be appropriate to take your child in to seek help. And so the first thing I would do is encourage you to compare this issue and think of it in the analogy of an emotional issue versus a physical issue. So when you are physically ill, imagine your child has a broken bone or an infection somewhere. When they have a physical illness that goes beyond the scope of your expertise, you go to the doctor. Right? You may very well know how to handle a splinter. You may very well know how to handle a minor cut, a bruise. You might even be comfortable with a sprained ankle. But when it gets much beyond that, when a bone is broken, when you suspect there's an infection or a virus, you take them to your family doctor because that goes beyond what you are capable of helping them with on your own. And I would say the same is going to be true with a mental or emotional problem. When your child is dealing with something that you believe you can help them with, when they're struggling with maybe anxiety about a test tomorrow, or some mild sadness about a breakup of some kind, it may be completely appropriate for you to help them through this. But when you start to suspect that their mental and emotional distress goes beyond the level of your expertise, that's when it's time to go seek help. And so you might ask yourself, well, how do I know what a mental and emotional situation looks like when it's beyond my expertise? And that's one of the things that I want to talk to you about today. But first, I would encourage you that we need to destigmatize mental and emotional distress. And what I mean by that is oftentimes people don't want to seek help for their young person when they are in mental and emotional distress because of the stigma that surrounds going to seek help, going to see a counselor or a psychologist or even a psychiatrist. There is this idea that must make you crazy. Only people who are crazy go to seek help for their mental or emotional distress. And I would, again, encourage you to remember that just like with a physical issue, your mental distress has needs. There are things that you're not going to be able to handle on your own. And when you reach up against those limits and those boundaries, it's time to go seek help. And there's nothing wrong with it. And in fact, many people reach the point where they need help with an emotional issue. And it's much better to go seek help from a professional than to pretend you don't need that help and then the issue gets worse. But my goal for today is to show you what it might look like when your young person is in distress. And so I'm going to talk to you about the symptoms of a couple of really common emotional issues. And so I don't want you to think, you're going to be qualified to diagnose a mental illness, but the things that I see happening more often than not in young people, I'm going to tell you what those things look like. And so we're going to talk about the symptoms of a depressive disorder, and we're going to talk about anxiety. So a major depressive disorder is characterized by episodes. And so you might have a period of time where you are emotionally distressed. So we're going to be particularly talking about a depressive episode. And so with a depressive episode, you're going to see a series of symptoms that you may be seeing in your young person. And this is something that I want you to be looking out for. So we're talking feeling sad or reporting sadness or reporting that they sort of feel flat or feel, a lot of times a young person will say, I just feel or I feel blah. And so you'll see that. You'll see trouble with sleep, and that might look like too much sleep. It might look like unable to stay asleep or unable to fall asleep, waking up in the middle of the night. And again, that might also translate to trouble staying awake in school because they're not sleeping at night, so now they're falling asleep in class. You might see a loss of appetite. You might see too much of an appetite, so they're overeating or undereating and losing or gaining significant amounts of weight. And so we're talking, what is significant? You're talking roughly 5% of your body fat in a 1 month period is going to be something we would consider significant. So you'll see that. You'll see a loss of interest. And what that means is the things that your young person used to like to do, they don't feel like doing them anymore. Maybe they love playing Fortnite, but they're not logging on, they're not playing, they don't feel like it. Their friends ask them to go play or go to the mall or do whatever, and they just don't feel like doing it. That's what we would call loss of interest. Another big one is lack of motivation. So you have trouble getting them out of bed in the morning. You have trouble getting them to do their homework. And I know a lot of parents are watching this thinking, well, that's my teenager every day, all day. And that part is true. Some of these symptoms, if you see them by themselves, they're not a major issue. But it's really when you see all these symptoms in connection with each other. When you see 4 or 5 of these symptoms together in a 2-week period, that's when you really want to be concerned. You also see trouble concentrating. And then the other major concern is thoughts of death. So again, it is not uncommon for a young person to think about death, have passing thoughts of death. That's not all that strange. But when the thoughts become more and more persistent, that's when I'm worried. And one of the major concerns with a depressive episode is the risk of suicide. So thoughts of actually bringing harm to oneself, that is a real major concern with a depressive episode. And that's, again, one of the reasons it's going to be important that if you see these symptoms, you consider taking your young person in to a professional so that the professional can assess whether or not this is a clinically significant issue. Okay, so if you see the symptoms that I just talked about in a sort of concentrated amount of time, couple of weeks, where you see more of those symptoms than you would like, it may very well be time to take your young person in to their family doctor, to a counselor, a social worker, even a psychiatrist. Okay, so that's a depressive episode. And then the other one that I commonly see among young people is anxiety. And so what I would want you to understand is what we call generalized anxiety. And what we're talking about here is a young person, or anyone really, who is worried about almost everything, almost all of the time. And so with this one, we're talking the time period is usually longer. If you see over the course of a few months, you see a person who has trouble concentrating, they are irritable, they get tired really easily, they seem tense, and have sort of agitation, so they're fidgety and they can't sit still. That may very well be signs of generalized anxiety. Now, you also may very well see some anxiety that is not generalized. They may have anxiety that is specific to certain situations. Maybe it's test anxiety. Maybe it's anxiety that is related to being in social situations. And so I'm seeing a lot of social anxiety, which is anxiety that is centered around a fear of being the center of attention. So any situation where a young person is afraid to be the center of attention, doesn't want to be looked at, stared at by everybody, that's what we would call social anxiety. And again, these are both the anxiety issues and the depressive issues are issues that you really want to consider. If you see these things, it may very well be time for your young person to get some professional help. And so I oftentimes have parents asking me, so how do I know when it's gone beyond normal teenager worries? And that's a good question. You're going to have a young person that breaks up with somebody. There's going to be a fight at school and they are on the outs with their best friend. They're going to fail that test and they're going to mope around. And teenagers mope around. That's just kind of the nature of the beast. And what I always encourage young people to think about, and what I encourage you as parents to think about, is, does this look like it goes beyond normal teenager stuff? You know, if you as a reasonable parent are saying, okay, this is going on a little bit too long, I'm unable to talk to my young person about this. I can't get anywhere. I'm not making heads or tails out of this. What should I do? If you're asking yourself that question, then it's probably time to seek help. And I also encourage you, again, like I said, to destigmatize this in the sense that there's nothing wrong with seeking help. And so, you wouldn't feel strange at all if your young person had an infection on their arm. You have a cut, it gets infected, there's pus coming out of it. You wouldn't feel strange at all going to the doctor and saying, hey, can you take a look at this? It might very well be nothing. They throw some peroxide or wipe it down or do whatever they're going to do, and you leave out of there and it's totally fine. Well, the same is true of seeking mental or emotional help. It is not uncommon at all for a young person to be brought to me by their parent, and I send that young person out and say, no, they're totally fine. It's good. Here's what I want you to do. I want you to think about this, or I want you to just talk to your parents more. And that is not strange at all. And so we really do have to take away that stigma that goes along with seeking mental or emotional help, so that young people will be reaching the help that they need. So they'll be getting the help that they need when it's time to seek that help. Because unfortunately, especially with depression and anxiety, suicide is a serious concern. And that is a major risk with respect to depression, particularly, but also with anxiety. And among young people, among teenagers, that is one of the leading causes of death. And so you don't want to say, he'll be fine, she'll be fine, and then you figure out too late that they weren't fine. And so I encourage you to, take these few tips when you feel like, you know what, I don't think I understand what's going on with my young person. This goes beyond what I feel comfortable helping them with. It's time to seek help. And so that's all we've got for today. Thank you for tuning in. With today's consult, I'm Dr. Ruben Brock. This is House Call.